Forget everything you think you know about heart problems. I'm not here to talk about dramatic chest clutching moments you see in the movies. The truth is, heart failure, a condition where your heart gradually weakens, often begins with whispers, not screams. And most seniors dismiss these subtle signs as just part of getting older until it's too late to easily reverse the damage. Today, I'm going to walk you through the 10 early sneaky signs of heart failure that you should never, ever ignore, especially if you're over 50. Knowing these could not only add years to your life, but quality to those years. Why early detection is your greatest power. First, let's be clear. Heart failure doesn't mean your heart has stopped. It means it's become too weak or too stiff to pump blood efficiently throughout your body. It's like a muscle that's gotten tired and flabby. This is especially common in adults over 60, particularly if you have high blood pressure, which forces your heart to work harder for years, diabetes, which damages your blood vessels, or a history of coronary artery disease. The most critical thing to understand is that this condition usually develops slowly and silently. The early symptoms are masters of disguise, often masquerading as normal fatigue, a bad night's sleep, or just slowing down. But here is your power. The earlier you catch it, the more you can do. With the right lifestyle changes and medications, you can often reverse early stage heart dysfunction or control it effectively for decades. You are not powerless. The 10 early signs of heart failure. Seniors must recognize. All right, before we jump into these 10 critical signs, I need to share a big personal goal with you all. I'm on a mission to hit 1,000 subscribers by the end of this month, and honestly, I can't do it without you. If you're over 50 and you're serious about taking control of your health, you're my people. Please help me out. Hit that subscribe button and like this video right now. It takes you 2 seconds, but it means the world to me and this channel. Now let's get to the heart of the matter. Literally, here is the first sign. 1. Unusual fatigue. Even after rest, this isn't just feeling a bit tired. This is a deep, overwhelming exhaustion after simple tasks that you used to do without a second thought, like making the bed, getting dressed, or walking to the mailbox. It happens because your heart isn't delivering enough oxygen-rich blood to your muscles. They're literally running on empty. This is often the very first sign, and the one people write off most easily. 2. Shortness of breath, especially while lying down. Pay close attention to how you breathe when you lie down. If you find yourself needing more pillows to breathe comfortably, or if you suddenly wake up at night gasping for air, a condition called paroxysmal nocturnal dyspnea, this is a major red flag. When you lie flat, fluid that has accumulated in your body can seep into your lungs, making it feel like you're drowning. It's a classic sign your heart is struggling. 3. Swelling in legs, ankles, or feet. Edema. This swelling, called edema, happens because your failing heart can't pump blood back up from your lower body effectively. Gravity takes over and fluid leaks into the tissues. You might notice that your socks leave deep lines or your shoes feel tight by the end of the day. The key is that this swelling often gets worse as the day progresses and may improve overnight when your legs are elevated. 4. Persistent cough or wheezing. If you have a cough that just won't quit, especially one that produces white or pink tinged mucus, don't just assume it's a cold or allergies. This is often a cardiac cough caused by fluid building up in your lungs, a condition called pulmonary edema. It's your body's way of trying to clear what doesn't belong there. 5. Sudden weight gain. Gaining 2 to 3 pounds in a day or more than 5 pounds in a week is almost always due to fluid retention, not fat. This is a direct sign that your heart function is declining. You might notice your clothes feeling tighter, your rings not fitting, or your face looking puffy. If you're at risk, Daily weighing is one of the simplest and most effective monitoring tools. 6. Rapid or irregular heartbeat, palpitations. Feeling your heart flutter, pound, or skip a beat when you're at rest is a sign that it's working. Over time, to compensate for its weakening pump, this can lead to serious rhythm problems like atrial fibrillation, which significantly increases your risk of a stroke. Don't dismiss it as just anxiety. 7. Loss of appetite or nausea. When your heart isn't pumping effectively, it prioritizes blood flow to the most critical organs like your brain. Your digestive system gets shortchanged. This can lead to feeling full very quickly, a lack of interest in food, or even persistent nausea. In elderly patients, this is often mistaken for a gastrointestinal issue. 8. Confusion or trouble. Concentrating. This is a subtle but dangerous sign, especially in older adults. When your brain doesn't get enough oxygen and nutrient-rich blood, it can't function properly. You might experience brain fog, memory lapses, or feel disoriented. This is often misattributed to aging or dementia, when the root cause may be your heart. 9. Chest discomfort, not always pain. This isn't the sharp stabbing pain of a heart attack. It's more often a feeling of pressure, tightness, or heavy weight on your chest. It's crucial to know that women and people with diabetes are far more likely to experience these atypical symptoms instead of classic chest pain. 10. Decreased ability to exercise. Notice if you can't do the things you used to do. If a walk around the block now leaves you breathless, or you find yourself avoiding activities because you know they'll wipe you out, your heart is sending you a signal. It can't meet the increased demand for oxygen during exertion, so it forces you to slow down. When to see a doctor and be your own advocate. If you recognize 2 or more of these signs, especially that crushing fatigue and shortness of breath, it is time to see your doctor. Do not wait. When you go, be your own advocate. Don't just say, "I'm tired." Be specific. Say, "I get short of breath making my bed," or "I've gained 4 pounds in 3 days." And then ask for the right tests. Specifically request a BNP or NT-proBNP blood test. This is a key marker that shows if your heart is under strain. An echocardiogram. This is an ultrasound of your heart. It shows exactly how well it's pumping. An ECG to check your heart's rhythm. A chest x-ray to see if there's fluid in your lungs. My top tip, start a symptom diary today. Write down your weight every morning, note any swelling, and record how you feel after simple activities. This data is gold for your doctor. Heart failure doesn't have to be a frightening death sentence, but ignoring these early signs, that is the real danger. Your body is talking to you. It's time to start listening, start noticing, start tracking, and have that conversation with your doctor before it becomes an emergency. Now, I want to hear from you. This is a safe space. Which of these signs have you noticed or perhaps ignored until now? Share your experience in the comments below. Your story could be the wake-up call someone else needs. If this video opened your eyes, please share it with a friend or family member over 50. This information is too important to keep to yourself. And if you believe in taking control of your health, subscribe to the channel and hit the notification bell. We're here every week with science-backed, honest health tips to help you stay strong, sharp, and independent for years to come. Thank you for watching and for taking this step for your health.